Arizona seeing the first confirmed COVID-19 case at an immigration detention center in Eloy, and now human rights activists are calling for the release of the most vulnerable. They claim CDC guidelines are not being followed and fear the worst. ABC 15's Melissa Blasius with a look at the case and what the current detainee says is happening inside that facility.
A ticking time bomb just waiting to go off. That's what human rights activists say they're trying to prevent inside Arizona's immigration detention centers.
We have, Governor Ducey's plan to prevent the outbreak, but there is no set plan in these facilities.
Sandra Castro is a community organizer with Puente Human Rights Movement in Phoenix. She says incarceration is not a public health care solution.
It's going to contaminate individuals who are in the same facilities, in the same quarters. So we're talking about a cross-contamination all over the board.
Sandra says it's been weeks since they started advocating for the release of people over 65 years old and those with underlying health conditions to prevent the spread. But now Arizona has the first confirmed case of COVID-19 in an immigration detention center. A 45-year-old Guatemalan national at the La Palma Correctional Center in Eloy. According to ICE, they're following CDC guidelines, and those who have come into contact with the individual have been cohorted and are being monitored for their symptoms.
It's frustrating.
Ana Montes de Oca disagrees. She was at the La Palma Detention Center this week and says there's little information about how many people were in contact with the infected person.
I saw very few people there with masks, the gloves.
Just last night, we spoke with a detainee inside La Palma. He said they were in lockdown, but he did not know why. He says, "We are in the tank, a confined room with over 100 people. We don't have soap to wash our hands. We're not keeping social distancing." ABC 15 has received letters from families that are begging the federal government for compassion and for the release of their loved ones. Release under certain conditions.
ICE has the capacity to do check-ins, right? To do ankle monitors.
That's what Montes de Oca says could help flatten the curve. In Phoenix, I'm investigator Melissa Blasius, ABC 15 Arizona.